Hi there, if you're watching this, you may be scheduled for a hysterectomy or considering one. That can feel a little overwhelming, but don't worry, we're here to walk you through what a hysterectomy is and what you can expect. Let's start with the basics. The uterus, also called the womb, is a muscular organ located in your pelvis. Its job is to house and support a pregnancy. Connected to the uterus are the fallopian tubes and the ovaries. A hysterectomy is a surgical procedure to remove the uterus. This means that after a hysterectomy, you will no longer have periods and won't be able to get pregnant. Now, there are a few different types of hysterectomies, and this is where things can get a little confusing, so let's break it down. A total hysterectomy is when both the uterus and the cervix are removed. In a partial hysterectomy, the uterus is removed, but the cervix is left in place. The radical hysterectomy is more complex, and it's usually done for certain cancers. We won't get into too many details since this is probably not what you will be having. Sometimes the ovaries and fallopian tubes are also removed during a hysterectomy. If both ovaries are removed, that's called a bilateral oophorectomy. If both fallopian tubes are removed, that's called a bilateral salpingectomy. If the ovaries are removed, you may go into surgical menopause because your body will stop producing the hormones estrogen and progesterone, and you may need to take hormone replacement. If your ovaries are left in place, you will go through menopause at your natural age. Now let's talk about the different ways a hysterectomy can be done. There are 3 common approaches to performing a hysterectomy: laparoscopic, vaginal, and abdominal. Laparoscopic hysterectomy involves making small incisions and using a camera to guide the surgery. This can result in less pain, a shorter hospital stay, and quicker recovery. Vaginal hysterectomy involves removing the uterus through the vagina and does not need an incision made. This method doesn't require any external incisions, but not everyone is a candidate. Abdominal hysterectomy is a more traditional approach, where an incision is made in the abdomen to remove the uterus. This is just like a C-section scar. Open hysterectomy is typically used when more access is needed, or in cases with complex issues requiring a larger abdominal incision. This method generally requires a longer recovery time. Now, you might be wondering, should I worry about which type of hysterectomy I'm getting? The truth is, you don't need to stress about the terminology. Your doctor will recommend the type of hysterectomy that's best for your specific situation, whether it's for heavy bleeding, fibroids, endometriosis, or other health concerns. Remember, you're not alone. Your healthcare team is there to guide you through this every step of the way. Thanks for watching and take care of yourself.